guys, welcome to my channel. My name is Sidra and I'm a pharmacist. I'm here so you can ask your pharmacist all your health and pharmacy related questions and I'll try my best to answer them. In today's video, I'm going to talk all about pain. And I'm sure all of you guys at some point in your life have experienced this unpleasant feeling of pain. So I want to provide all the information you need to know to manage pain in a safe and effective method. In this video specifically, I'll be discussing non-opioid and opioid treatment options, their side effects and warnings. So grab your cup of coffee and stick with me till the end of this video. Guys, before we start, I want to give a quick disclaimer that this video is for information purpose, not providing any medical advice, and this information does not replace the visit to your doctor's office. Alright, now let's start for real by defining what is pain. The International Association for the Study of Pain defines it as an unpleasant sensory and emotional experience associated with an actual or potential tissue damage. Pain is actually a signal in our nervous system that something may be going on wrong. It is an unpleasant feeling such as a prick, tingle, sting, burn, or an ache. It could be sharp or dull, it may come and go, or it may be consistent. You may feel pain in one area of the body, or it could be just a generalized pain. Now, you'll be surprised to know that in most developed countries, pain is actually the #1 reason for patients to seek medical help. Okay, it is major symptoms in many medical conditions, and it can actually affect the quality of a person's life. The Joint Commission has actually set the standard that pain must be treated in the same manner as any other vital signs. Like, they've made it compulsory for the healthcare professionals to inquire about it, measure it in the same manner they would treat blood pressure, respiratory rate, or treat any other health condition. Now the question arises, how do we measure pain? Firstly, primary measurement of assessing pain is patient's own report along with behavioral observation. Pain scales are used to assess the severity of the pain. There may be different kinds of pain scales, but the most common one used is the numeric scale, where we ask the patients how severe is the pain, ranging from 0 to 10. Here 0 means that there is no pain and 10 refers to the severe or the most extreme pain. And the number 4 to 7 are kind of moderate pain. Alright, now let's switch gears and talk about the types of pain. Firstly, we have the acute pain. Acute pain is actually a signal from the body that lets you know that it may be injured or have a problem and you need to take care of it. Acute pain is of short duration and is directly related to soft tissue damage, and for example, sprinkle of an ankle or a small kitchen cut on the finger. This pain gradually resolves as the injured tissue is healed. The second type is the chronic pain. Chronic pain is very different from the acute pain in a way that it is longer lasting. It keeps you hurting for weeks or months or even for years after the injury. In other words, any pain that lasts for 3 to 6 months or longer is a chronic pain. It could be because of an underlying health condition such as arthritis, nerve pain, could be a post-shingles pain, or could be just due to poor monitoring of glucose in a diabetic patient. Third category is the breakthrough pain. It is a severe pain that erupts while a patient is already using an extended release or a long-lasting painkiller. It is basically end-of-dose pain. This type of pain is more common in cancer patients and is treated with some short-acting or immediate release medication. The next category of pain is psychological pain. Now, a lot of you probably may not have heard of this, but it's very important to recognize and diagnose and treat this kind of pain because it is as painful as any other kind of pain. It could be acute or chronic. Psychological pain, also known as mental pain or emotional pain, is an unpleasant feeling of psychological or non-physical origin. Similarly, your mind can cause pain without any physical source or make pre-existing pain worse or linger. This phenomena is called psychological pain or psychogenic pain. In a nutshell, it occurs when your pain is related to underlying psychological, emotional, or behavioral factor. It is not entirely clear why your brain sometimes causes pain when there seems to be no physical source. Now, some theories suggest that it is due to pain memory, a condition that causes nervous system to hold on to pain after an injury has been healed. Others suggest that this pain may be caused by signals confused within the brain. Whatever the cause of this pain is, it should be very clear that psychogenic pain is a real pain and must not be overlooked. Unfortunately, the dilemma of our society is that pathogenic pain and other seemingly invisible disorders have been met with skepticism or stigmatization from friends, family, or place of work, or even healthcare professionals. This needs to change, and we need to understand why we are getting this emotional or psychological pain. What could be the underlying cause? We need to find out the underlying root cause and try to treat it accordingly. You need to know that if you're suffering from this pain, it's very real and you deserve to be taken seriously and deserve the right treatment. Alright, next let's talk about pain management. Some minor pains go away on their own. However, in severe cases, we need to manage it. It's very important to prevent or treat the severe pain, since delaying the treatment may worsen it. And then in that case, you may require a higher dose of the pain medication. As a general rule of thumb, the lowest dose that adequately reduces the pain is considered to be the appropriate dose. Also, using the combination of pain medications that work by different mechanism of action can better manage the pain, because now we are adding on the effect of two medications and it's giving a synergic effect. A good example is adding a non-opioid like acetaminophen, the name brand of which is Tylenol, to hydrocodone, and the combination is very famous to treat the pain. Now let's see what medications we can use to manage our pain. First, let's talk about acetaminophen, or our name brand Tylenol, which is very commonly used all over the world. Acetaminophen is an analgesic and antipyretic, which means it can treat your pain and fever. It reduces the production of pain-causing hormone prostaglandin and also reduces the generation of pain impulse in the brain. Now, Tylenol can be given to children and infants also. The normal dosing is 10 to 15 milligram of Tylenol per kg and is given up to 5 times a day as needed. It's a pregnancy category C drug and can be used for mild pain relief in pregnancy. For adults, the Tylenol dose must not exceed more than 4,000 milligram a day, as overuse of Tylenol can cause liver damage, and this can be worsened by the concurrent use of too much alcohol. So, as a general rule, just remember, women should limit to 1 drink of alcohol in 24-hour period, and men should limit to 2 alcohol drinks in a 24-hour period. Another key point about Tylenol is that it's available over the counter in the form of tablets, capsules, chewable, suppositories, liquid, syrup, and suspensions. Alright, let's switch gears and talk about non-steroidal anti-inflammatory drugs, also called NSAIDs. These drugs not only reduces pain and fever, but are also anti-inflammatory. They inhibit the COX enzymes, which are involved in the production of the pain-producing hormones, prostaglandins, because of which pain, fever, or inflammation are reduced. It's very important to note that all NSAIDs have a warning of not to be used in pregnancy, those with a history of gastric bleeding or ulceration. Also, all NSAIDs except aspirin have cardiovascular risk, including heart attack and stroke. And aspirin, in fact, is a cardioprotectant. We've talked so much about NSAIDs. Let's see what medications are included in this category. NSAIDs include Motrin, Aleve, naproxen, aspirin, diclofenac, ketorolac, Mobic, which is also called meloxicam, celecoxib, indomethacin, and many more. As far as the interaction of these medications are concerned, since they have a risk of bleeding, therefore they should not be used with any blood thinners. For example, warfarin, Plavix, also some herbal medications and some antidepressants such as SSRIs or SNRIs. Also, do not use NSAIDs with steroids like prednisone or dexamethasone due to high risk of stomach bleeding. A very important point that 2 NSAIDs should never be used together because of the toxicity risk. However, there is one exception, which is aspirin. If you're using baby aspirin, that's 81 milligrams of aspirin as a heart protecting along with NSAID, that's totally fine. But make sure that you use your baby aspirin at least an hour before your other NSAID or 8 hours after using the other NSAID. Other important counseling points I like to tell my patients about NSAIDs are take it with food or milk because it can upset the stomach or can irritate the stomach. The medication can raise the blood pressure, so make sure to monitor the blood pressure when on this medication. If you do not use any other medication in this class, also do not use this medication if you had allergic reaction to aspirin or any other NSAID. Next category of non-opioid pain medication include Muscle relaxants. Muscle relaxants are medications used to treat muscle spasms or muscle spasmicity. Now, what are muscle spasms? They are basically cramps or sudden involuntary movement of group of muscles or just one muscle. They can be caused by too much muscle strain and lead to pain. They are associated with conditions such as low back pain, neck pain, or fibromyalgia. If the pain is severe or chronic and does not respond to over-the-counter medications, then our muscle relaxants come into rescue. These medications are used in addition to rest, physical therapy, and other measures to relieve the pain. Now, these medications are not something to be used for a long period of, they're used very short term. Some of the muscle relaxants are baclofen, tizanidine, methocarbamol, carciprodol, or cyclobenzaprine. Some common points that you need to know about muscle relaxants are that all of these actually cause drowsiness. Now, the muscle relaxants that I've just mentioned are not included in one category. They're not classified as one single class of medication. Their mechanism of action is different, but they all have one thing in common, that they cause drowsiness. So do not use them while driving or operating machinery. Also, do not take them with alcohol or any other medications that also cause drowsiness effect, as this can double the drowsiness effect. Next, let's talk about nerve pain. Now, nerve pain is not your typical pain which occurs, for instance, if you drop a heavy book on your foot and that causes pain. No, it's not that kind of pain. It feels more like burning, stabbing, or shooting pain, along with numbness or tingling sensation. Especially they say like tingling in the fingers of the hand or toenails occur. Neuropathic pain can be a symptom or complication of several diseases and conditions, which could be multiple sclerosis, multiple myeloma, or other types of cancer. According to Cleveland Clinic, diabetes is responsible for 30% of neuropathic cases. People with diabetes commonly experience loss of feeling in numbness, falling pain, burning, and stinging in their limbs and digits. Another cause of neuropathic pain could be long-term and excessive use of alcohol, which in addition to many other complications can also result in damage to nerves. Injury to tissues, muscles, joints of back, leg, or hip can also result in some nerve pain or nerve damage. It's very unfortunate that an injury may heal, but the damage done to the nervous system may not. As a result of that, you may experience persistent nerve pain for extended period of time, for years or forever. Another cause of nerve pain could be herniated disc. When disc bulges, it could actually put pressure on the surrounding nerves, and that could damage the nerve and result in the nerve pain. Lastly, infections like shingles, which is caused by reactivation of chickenpox virus, can trigger several weeks of neuropathic pain. Alright, now let's switch gears and talk about treatment options of this horrific nerve pain. Mostly antidepressants like amitriptyline or duloxetine have been proven to be effective in the treatment of the nerve pain. Keep in mind here, the dose of amitriptyline is way lesser than the dose of amitriptyline used as an antidepressant. Other options include Lyric, which is the name brand for pregabalin. It is a class 5 drug because the drug has a tendency to cause euphoria. Otherwise, the medication is great and is very effective in the treatment of nerve pain. Gabapentin is another medication used in the treatment of the nerve pain. It's similar to Lyrica and has a similar side effect, which include dizziness, weight gain, double or blur vision, and dry mouth. However, gabapentin does not cause euphoria, and it's not a controlled medication in California. Next, we'll talk a little bit about topical pain relieving aids, which provide more like localized pain relief. Firstly, let's talk about lidocaine. Lidocaine is a numbing agent. It's available in the form of a patch and topical ointment or cream. 5% lidocaine topical patch is available as a prescription only, but the good news is that the 4% is actually available over the counter, and both have a little bit of difference in the efficacy. This is one of the few patches that we can cut and apply directly on the painful side of the body. Make sure not to apply more than 3 patches at one time. Also, the patch is applied as 12 hours on and 12 hours off in a 24-hour period. Make sure not to cover the patch with the heating pad or an electric blanket, as that could increase the absorption of the medication and may result in the toxicity. When you're done using the patch, fold the sticky side and discard them properly, as it could harm children and pets. Alright, now let's switch gears and come to the most important topic of this video, that is opioids. This is literally my most favorite topic to talk about, because as a pharmacist, I literally seen the journey of the patient starting with just a week's worth dose of the opioids and then continued for years and years. Firstly, you need to know what opioids are. Opioids are the class of drugs which include illegal drugs like heroin, which is made from a plant, and we also have synthetic opioids, which include fentanyl or pain relievers like oxycodone, methadone, hydrocodone, codeine, morphine, etc. These are the examples of synthetic, very commonly used as a prescription medication. Now, all opioids are chemically related and interact with the opioid receptors on nerve cells in the body and brain. Using opioid pain relievers is fine as long as they're used for a very short amount of time, but the more your body uses it, the more the body kind of becomes dependent on it. These medications tend to produce euphoria in addition to the pain relief. That's why they're highly misused. They're mostly taken in larger quantities, more than prescribed, and sold in the street as street drug. Although it's illegal, people still use it without a prescription. Regular use of the opioids can lead to dependence, and when misused, opioid pain relievers can result in addiction. Lately, we've been dispensing a lot of naloxone or Narcan, which is an opioid reversal. It's a very important medication to have, as this medication can be used to reverse the opioid overdose. A lot of patients ask me, why do they need to have the Narcan when they've been using opioids for a very long time just fine? Well, the answer is that even though you've been using opioids for a very long time, your body is kind of used to it, but still there is a risk of respiratory failure and death can occur. Think of it as a fire extinguisher. You know, you have the fire extinguisher at your home or workplace or in a big building because there is a risk of fire. Although you may never use it, but it's still there in case you ever have to use it. Now let's talk about some facts on the opioids, and these facts are especially very important for the parents of the teenagers. Now, to the parents of these teenagers, I'd like to say that you've probably heard a lot about opioid crisis in the TV and news lately, but what are opioids? What do they have to do with you as a parent? Why is it important for you to know about it? Now, for instance, if your child is participating in a sport, has dental work done, or got some kind of injury because your child fell and had a fracture probably. Now, when you take your child to a doctor, most likely your doctor is going to prescribe some kind of pain reliever for a short-term use after a surgery, fracture, or some kind of dental work. Now, it's important that you realize that these are addictive medications and they have the tendency of misuse, especially in the teenagers. So you have to be very careful of what's going on around your child. All opioids, particularly when misused to get high, along with alcohol or tranquilizers, can result in deadly overdoses and death can occur. While the opioid misuse in teens has been going down, the rate of opioid misuse increases significantly after the age of 18. So it's very critical to talk with teens early and frequently to protect them from experimenting with opioids as they transition into the adult. You know, I understand that talking to your kids about drugs is not essentially very easy, but it's very important. Now, what's the connection between prescription opioids and heroin? Prescription pain relievers and heroin are chemically similar and produce similar effect, but you can become addicted to both and overdose in both. Some people get addicted to prescription opioids, and when they are not able to access those, they actually transform or switch to heroin. Others just simply start using heroin, and about 80% of people who use heroin have actually first used the opioid medication. Now, what are the effects of heroin on body, brain, and behavior? Just like other opioids, heroin binds to opioid receptors in the brain and body, causing euphoria and relieving pain. This means that the short-term and long-term effects will be similar to those experienced from prescription opioid. However, people who inject heroin can actually experience collapsed veins. Now, what are most commonly used prescription opioids? Like I mentioned earlier, most commonly used prescription opioids are hydrocodone, Percocet, OxyContin, oxymorphone, morphine, fentanyl, codeine, etc., etc. And how do these medications affect our brain and make people high? Opioids attach to and activate opioid receptors located in many areas of the brain, spinal cord, and other organs in the body, especially those involved in the feeling of pain and pleasure. When opioids attach to these receptors, they actually block the pain signals sent to the brain and release large amounts of dopamine in the brain's reward regions. Dopamine is a chemical responsible for pleasure and motivation of our actions. reactions. This release can strongly reinforce the act of taking the drugs, making the user want to take the drug again and again despite of the negative consequences. As far as the health effects of opioids are concerned, they cause extreme drowsiness, confusion, blur vision. And now it's important to know that a lot of these side effects kind of tend to go away as you use the opioid more often, but constipation is one of the side effects which does not go away, or the body kind of does not depend to it as you continue to use the opioid. Now we need to know how can people misuse the opioids. Taking prescription, one of the most common example of the misuse of the opioids is taking a prescription medication in a way other than instructed by the doctor, taking it more than prescribed and more often, getting and using a prescription medication of opioids from friend or a family member, or maybe just buy it from the street, even if there isn't a real health condition that requires the pain medication. Also taking the pain medications just to get high, mixing the opioid medications with alcohol, tranquilizers, benzodiazepines, and muscle relaxants. It's also a very common way of abusing the medication. Some people may just crush the pills or open the capsules and inject it in the vein, or simply just snort the powder. So by now we know that the opioid addiction can really affect the health, well-being of a person or a child. So it's very important to start that conversation with a person who you think is actually dependent on the opioids. So here are a few tips for the parents out there. Be a good listener to your child. Set clear expectations about drug and alcohol use, including real consequences, and also make it like a family rule and make sure that your child follows it. Also help your child deal with peer pressure or use of drugs. Get to know your child's friends and their parents. If you're concerned, have your child evaluated for mental health issues like depression or anxiety. Monitor your child's whereabouts and behavior. Also, be responsible and do not leave your unused opioid medications in accessible places where your child or any other person can access it. Finally, do not ignore the signs that your child is changing in negative ways. Opioid crisis is such a big crisis that my heart goes for all the people who are suffering for it, and I'm devastated by their health conditions. And this topic is something that I can go on and on. We have to make sure that we create general awareness in the society and act very responsibly when it comes to opioid medication. I do want to mention here that due to opioid crisis, patients who are really in need of higher doses of opioid perform their everyday tasks are actually sometimes underprescribed, due to which they suffer and may exhibit the signs of pseudo addiction. So it's important here to understand the term pseudo addiction. A very prominent sign of pseudo addiction is when we see patients anxious about running out of their pain medications because they may have used it too quickly, and reason being that the prescribed medication was not sufficient enough to take care of their pain. The response of this type of patient is not to scold, but pharmacists and other healthcare professionals should show empathy to this patient and try to ask open-ended questions to get to the root cause of the pain, and then work with the patient to find the best treatment plan. For instance, if a patient is using long-acting opioid like OxyContin 1 tablet every 12 hours, but according to patient, he or she begins to experience intense pain in the middle of the day, kind of a couple of hours before the next dosage. That means patient is experiencing end of dose symptoms, so try to incorporate a short-acting analgesic or opioid like Norco or Percocet in their treatment plan. For patients who are taking intense doses of opioids, most commonly they experience constipation. We need to know how we can help these patients to treat the constipation, as that's the only side effect which the body does not get used to, and it does not vanish away as the patients continue to use the medication. The first line of treatment is of course over-the-counter medications, for example Docused, Senna, Miralax, maybe suppositories, and many other over-the-counter options. Once the patient has burned all these options, then we can go towards the prescription medications, for example, lactulose. Like I said, since constipation is the only side effect of opioid that the body does not adjust to even after using opioids for a long term, therefore, in some rare cases, patients have to go for intense treatment options to get relief from their constipation. This happens normally in cancer patients since they are on relatively larger doses of opioids and for a longer period of time. Also, these medications are prescribed as a last resort as they are opioid mu receptor antagonist. and there is a risk of opioid withdrawal with their use. But always, as a healthcare professional, weigh the risks versus benefit when using them and closely monitor the condition of the patient. A great example of opioid mu receptor antagonist for the treatment of constipation is Moventic and Rilastore. Another option for treatment of opioid-induced constipation with chronic non-cancer patients is Emetiza. This medication works by increasing the fluid in the gut, resulting in increased gut movement. Common side effects with the use of Emetiza are diarrhea, nausea, or headache. Finally, let's discuss some key points about counseling patients using opioid medications. Firstly, as mentioned before, these medications are habit-forming and cause a lot of drowsiness, so no alcohol with the medications or any other medications like benzodiazepines or tranquilizers that have the drowsiness effect. So if they're used with these medications, the drowsiness effect would be double. It's very important to let the patient know that they shouldn't drive or operate any heavy machinery after using the medication. A lot of opioid medications come in extended or controlled release formulations. Patients should be well aware that these medications should never be crushed, opened, or chewed. This is because these medications are designed to slowly release in the body over a period of 12 to 24 hours. If we cut or break the tablet, the medication is going to dump way too fast in the body, resulting in the toxicity, opioid overdose, which can cause respiratory failure and death can occur. For the liquid opioid medications, make sure that you're using a measuring device like a syringe, cup, or spoon. Pharmacy should provide you with these dosing devices, but if you don't get one, ask your pharmacist to give you one. Take these medications with a full glass of water, and if upset stomach occurs, then take it with food or milk. Lastly, do not share these medications with anyone and do not take more than prescribed without talking to your doctor. Also, make sure that you discard your medication properly. An easy way to discard them is first peel off the prescription label, add some cat litter or coffee beans, add some water, mix it well, and toss it in the garbage. Okay guys, so that concludes today's video. I hope you guys enjoyed it and learned a lot from it. Please hit the subscribe button so you can watch more videos like this. Also comment to ask your questions and give your valuable feedback. I'll see you next time. Take care. Bye.